Brandy Petrone with Goodman, Schwartz Public Affairs. We do represent APAD and SUE, do a lot of issues and work at the Arizona legislature when it comes to the disability community. So happy to be here today to talk to you all and just give you an update on where we are. Thought what we do is kind of talk about what sort of happened this last legislative session, put us all on the same page, where we were, talk about the election, and then talk about some possible issues that are coming up this legislative session. As always, feel free to ask questions. What I always talk about at APAD is that I know the legislative process, I do know the legislators, I know how this all works, but you all know all this stuff way better than I do. And so that's why it's such a team effort, is that we help everyone go down to the legislature and advocate, but it's really you all who are the experts that the legislators want to hear from. So please feel free to ask questions and chime in, because there's always things that I don't know, and so please add to the conversation so that we all have all the same information. So last legislative session, what we were doing was passing the state fiscal year 2017 general fund budget. What ended up happening is we had $9.61 billion in spending is what was passed. If you take all their total funds, that's a $36.6 billion budget for the state. So the state actually has a small portion, right, that they deal with if you look at the total budget for the state. They're expecting, what they expected is in fiscal year 2016, so the fiscal year that ended on June 30th of this year, that we will have a balance of $225 million, which would then roll over into the current fiscal year that we're in. We won't know if that's accurate until November or December. It takes several months to close out the books for the state. Hi guys, welcome. And what the legislature has been talking about a lot lately is having a structurally balanced budget. And when I was here back, I think in February, we talked about a lot about this as well. And what that means is that the ongoing revenues and ongoing expenditures for this state are equal, or that the ongoing revenues are more than expenditures. And that's what the legislature and the governor's office has been headed towards.
Brandy, can you just remind us, when you say FY 2017,
sure.
When does it begin? When does it end?
Sure.
And when you're talking about the federal versus the state, when does that begin and when does that end?
Sure. So the state fiscal year is on July to June. So this current fiscal year that we're in is state fiscal year 17, which started July 1. So you always have to think about, when we talk fiscal years, it's the year you're going into when you're talking about the numbers. So we're going into 2017, so it's state fiscal year 2017. The federal fiscal year, what we really care about at Access is October 1, when they are working on Medicaid and when they're drawing down from CMS. So Access works on an October 1 calendar that they're going on, and the state's working on July to June. So there are some times when what the legislature is passing doesn't always match up what we're doing at Access and Medicaid. So sometimes those come into conflict, and sometimes we have to wait. So it's a really good question. Thanks for doing that.
Can you explain drawing down funds so people understand what that means?
Sure.
Thanks.
Absolutely. So the Medicaid program has a state match and a federal match. And so the legislature has to appropriate monies for the majority of the Medicaid program. That state funding is then matched with the federal drawdown, so our federal match. And so when the legislature appropriates the state general fund, that's not the entire portion of the program that's being funded. They use that money then to bring down the federal match or to bring down that drawdown. And most of our Medicaid programs are like that. So you'll hear us talk about the federal match, you'll hear us talk about the drawdown, and we're matching those state dollars with the federal dollars to make the entire program.
Is it still 36-ish cents state?
Yeah, it's still roughly about that for DDD. And it changes, and really, yeah, for the majority of the program, it's 1/3 to 2/3 match on average. That's a pretty easy way to look at it. So we put up 1/3 as a state, and the 2/3 comes down from the federal government for most of our Medicaid programs on average.
Thank you.
Is it intentional that the state has the July to June and federal October to September, and is there an advantage to that, or is it just sort of like
That's a very good question.
old system? Does it cause problems?
You know, I don't know that it necessarily always causes problems. You just always have to plan for it. And I don't know when we started our state fiscal year. I don't know if it was ever different than it is today. Does anybody know?
No, and most states are on the one that we're on. They're on that. There's a few that are on the federal, and I think there's one, the last time I looked, that was on calendar, but most of them are on the same. I don't know where it originated.
Yeah, I have no clue. And it's been that way. This is my 15th legislative session.
It was
so
it?
At least for the last 15 years.
The Magic 8 Ball? The Magic 8 Ball said yes. So there you go.
What we have changed though in the state is we used to do biannual budgets. So we used to, when we passed a budget, we pass it for 2 years for most of the state agencies, especially the smaller ones. Some of the larger ones we would still have an annual basis, but when you passed a budget, you would pass it really for 2 years. And we got rid of that in 2001. We repealed all of the biannual budgets that had been passed because of the really bad fiscal times that the state was having. If they couldn't project enough, they couldn't project 2 years in advance to really know what was happening, so they repealed everything, started over, and we have not gone back to a biannual budget since. We've been doing 1-year budgets. But the state is required to look at 3 fiscal years by statute. So there was a law that passed that requires the governor and the legislature to look at 3 fiscal years when they pass the budget. So we enact a budget for 1 fiscal year, but within that budget are the estimates for the next 2 fiscal years. And so that's what you see up here. So when we passed the fiscal year 17 budget, the legislature's budget office, GLBC, and the governor's budget office, OSPB, the Office of Strategic Planning and Budgeting, had to come up also with estimates for 18 and 19. And so, again, same numbers that you saw before for fiscal year 17. We're looking at $9.61 billion in spending, $9.67 in revenue. So that's a surplus of about $66 million. But what makes this interesting is if you look at the structural surplus estimate, so that's what they're estimating ongoing revenues and ongoing expenditures to be at. So the rest of that money, that difference, they're not considering ongoing money. It was a one-time balance, basically. So they don't believe that that money will be going forward.
Which one?
The difference between the 66 and the 3. So 63 million out of fiscal year 17, they're estimating was one-time extra money. We're not going to have it again in the next year. We're only going to have that $3 million going over as ongoing revenue. So then you get into fiscal year 18, you take a look at the numbers, surplus of 145 million, structurally 103. So now we've got a little bit more of a structurally balanced budget, is what they're estimating. So ongoing revenues and ongoing expenditures are meeting. We have more revenues than expenditures, right? And then by 19, they're saying 418 million or 272 structurally.
I'm not getting the structural part. What is that number?
They're determining that the revenue that's coming in, we're not going to see again on a regular basis. So there was a reason in the economy, something happened, a tax windfall, whatever it is, that they don't think is going to come back. And so that money is considered not ongoing revenue. And that's a decision that gets made.
Are they, for the structural surplus, are they considering that to be the rainy day fund, or is there an actual line item that's?
There's an actual line item for the rainy day fund, and the rainy day fund is about $464 million right now. Currently, today.
Do you know what it was before 2008 when the economy crashed with the Great Recession?
I don't know. That's a good question. So the rainy day fund is actually relatively new, but I can't remember when we actually put it into place, what year that was.
Well, I know we wiped it out in 2010.
Yeah. So but I don't know what it was before that, no.
I'm just wondering if we're back to the levels that we were back to.
a good
Obviously,
question.
we didn't have much in 2001.
Right.
because we were doing budgeting tricks.
Right, absolutely. So again, this is just sort of the picture that right now the legislature has. I always think it's good to know what the legislature, what numbers they're getting, what numbers the executive is getting. I think it's also really important to point out that a 1% change. So let's say your estimates are off in revenue by 1%. It's a difference of $600 million when you look at these first 3 fiscal years. So budgeting is really hard, right? At this scale, it's hard for the legislature to really pinpoint how much money we're going to have and to have those estimates.
Do the projected revenues take into consideration all of the tax credits that are given to all these different programs, special schools and elsewise, so that reduction, because as I see that these are coming out of Children's Action Alliance and elsewise, it's
Right,
talking
right.
about millions of dollars in the future
You're correct.
that won't be available to us.
Yes. So what, and these numbers, as you can see at the bottom, come from the Joint Legislative Budget Committee. JLBC does in their projections include the tax cuts, and you're absolutely right. There were many tax cuts the legislature has passed over the last several years that are starting to come online. When they were passed to come on in future years, so 2 or 3 years later than when they were passed at the legislature. So those are starting to come online. You're absolutely correct. The numbers that I remember, and these are rough, so don't quote me on the specifics, but somewhere in the ballpark of about $600 million is what we were collecting in corporate income tax a few years ago, and it's now around $200 or $300 million is what we're collecting, are the rough estimates. And again, I'm probably off there a little bit, but that's what I remember hearing about. So you're right, the corporate, especially the corporate income tax, has changed a lot. So where did we spend our money in the fiscal year 17 budget? These are just some of the big ticket items that were in the budget. There was $36 million for the Department of Child Services, as you all know. DCS has been going through major issues. We've been seeing, unfortunately, a lot of newspaper articles about what's going on. And so the legislature's been working hard to address that issue along with the governor's office. There was $29 million for joint technical education districts. This is career and technical education, JTEDs, you might know them as. 2 years ago, the legislature had passed some changes to JTEDs that ultimately everyone figured out was going to be very, very bad for the JTEDs. And so during this last legislative session, they undid those changes essentially, and that cost $29 million to put those back up. We spent $8 million on the Border Security Task Force, did pay raises for DPS officers. And then what you might have seen in the newspaper is there was a lot of controversy over some freedom schools at Arizona State University and the University of Arizona. And there was a lot of controversy about where those freedom schools were coming from and who was backing them. And so if you saw the newspaper articles, that was a $5 million spend.
What was the spend on DCS the previous year?
Good question. Less than 36 million, but still a very good chunk. DCS for the last 2 fiscal years has been a huge, huge hit on the budget. As you all know, you've seen the newspaper articles. So it's been quite a chunk. I would say between DCS and education, those 2 items have taken a big chunk of money out of the state budget.
And the reason that I bring that up is one of the discussions we've been having when we talk to the legislature is these big chunks. You know, you guys always have to wait because Child and Family Services crashed and burned. You have to wait because there's a huge education lawsuit, right? So we continue to get pushed back on this when we try to get in and try to get some real money, as opposed to, not that we don't appreciate the 1%, because we do. We're very thankful.
Yes.
But at the same time, we've kind of constructed that argument of, okay, so how every time we try to get some kind of traction, something crashes and burns, right? So we need to work on us not crashing and burning. And they need to recognize that we're gonna crash and burn if we're not really, really cognizant of the issues that we're having right now.
Well, and I would say, if I can add to that,
Please.
I think generally, especially from an APAD perspective, we need to externalize the crisis and what's happening, because we are competing amongst these very large issues, very compelling other issues as well. And right now, that crisis isn't showing up amongst these other crises that the state is facing.
Do we know how much federal money for DCS that we're leaving on the table because we're not meeting federal requirements?
That's a good question. So at the JLBC hearing this week, DCS did talk about that, and it's my understanding they've actually pulled down more federal dollars than in the past, and for some of the programs they talked about pulling down 100% of what was available. I just don't know specifically what those programs are. So I wasn't listening, specifically for DCS, but just generally what I heard was that they're pulling more federal dollars down now than they were before.
And do we know how many federal dollars that we're not pulling down for DVD all text?
Well, so for DDD, what we would pull down out of the federal government is what the state matches, right? So it's really up to the state to provide that match, and then we're able to pull down from the federal. I'm not aware of other programs that we might be missing out on. Maybe somebody else is in the room, but generally speaking, it's if we can put up the state match, then we're pulling down that federal match.
I guess my point is one of the reasons that DCS is not pulling down their full federal match is because their program is not meeting what it needs to meet for the block grant. Whereas DDD, with DDD all text, we're not being penalized by the feds.
Yeah.
We're doing what we're supposed to be doing, and we're bringing the federal money in. It's the state not making the match that is restricting our funding. It's not that DDD is doing anything that's restricting.
Right. There's no programmatic issue that I'm aware of in DDD that's preventing us from pulling down any other dollars. Right.
What's a freedom school?
So the freedom schools, and what folks talked about in the newspapers, the freedom schools were backed by some big Republican donors nationally, and that those donors were then pulling in a Republican agenda is what was talked about through those freedom schools and talking about government and civic engagement. That's what I know.
They were funded, both were funded by the Koch brothers, and then they get to choose. Having a number of friends I meet with every Friday evening with professors at ASU. Part of the complaint is that the Koch brothers get to select the chair of the program, and they have selected persons who basically don't believe that public funded education can privatize public education. I tend to agree with my friends.
And this is, Brandy, they're basically public affairs schools at the two universities, right?
Yes.
And I happen to be an alumni of the Rockefeller College of Public Affairs and Policy at the State University of New York at Albany. And I can tell you, nobody got to choose the dean of the school or the chairman of any of the departments. And they do a lot of work for the state of New York. They're nonpartisan, they're very nonpartisan. So it's a major concern.
So that did get passed though?
Yep, it did. So access caseloads, these were just reported this last month in August. Just to give you an idea of where we are for the access population, they've seen the childless adult increase by 1.4%. The childless adults continue to increase for the state, and so does that expanded population that we added that went up to 133% of FPL. So those who couldn't get on the exchange that were in between, those are increasing as well.
Hey, Brandy?
Yes, ma'am.
Do we know how many of those individuals happen to have an autism diagnosis?
Don't know. Not that I've seen reporting out from them, but yeah.
That may be something that we may
Take a look at.
access to take a look at through the ASD Advisory Committee.
Oh, yeah.
Did we get those numbers last year?
Because that's a big portion of our population.
Sure.
Given our unemployment rate among adults.
Did they have that you're saying, Erin? No.
We were trying to get numbers like that in the committee last year.
We didn't
It seemed like it was really hard. They
Never got the
didn't seem to
numbers.
keep the data
Keep
very
it that.
specific to
Never got the
diagnosis.
data.
Okay.
We got some numbers, but I don't think it was that.
Okay. That's a good question. Taking a couple back, sorry. Okay. We'll see if we can ask. That's a good question. It's a very good point. For DCS, just to give you a sense to where DCS is at, again, these were reported in August, but they're April numbers. So their reports of child maltreatment was down by 1.4% year over year, comparing the same months. And then their out-of-home care remains about the same. So if you compare to the prior month, they were down just a little bit by 0.3%.
Question.
Yes.
So for that report, is that reports actually taken, like given to caseloads given to coordinators, or is that just reports coming in, like any reports?
So that one, I believe, is given to caseworkers, but I will verify and let you know. I can pull that report again and give it to Mary. Maybe we can make sure we send that around, but I need to pull that detail, make sure. And then, as you all know, DCS had the backlog issue. So these were the cases that were not investigated, found to not be investigated, and determined they should have been investigated. So we had that whole backlog of several thousand of cases. So DCS the legislature required them to set benchmarks for working through that backlog. They're required to report on a monthly basis, and so this is where they are on their backlog, and that it has been. They're slowly reducing it and meeting their benchmarks on the backlog.
And Brandy, that would be one reason that they would not be able to draw down federal funds because of a backlog, right?
I'm not aware. I'm sure that would be my guess, but I don't know.
Oh, yeah.
And then just some numbers from the beginning of the year. The folks that the kids that they're bringing into shelter care or group homes, and the number of kids that they've had in shelter care for more than 21 days. So just to give you all a sense of what's being reported and what's out there. That increase is going to cost if you provide services or to your families or whatever it is, to understand what's going to happen, because it goes into effect on July 1. It goes up to $10 or January 1.
Yeah.
January 1, $10. So right, we have a lot of direct support professionals in the industry that are making less than $10 an hour today.
Right.
And so that would be those are large impacts to agencies. So we're collecting that data. We're asking our APAD members to help us with that, and they've been doing a great job. And we're taking that information to the legislature to access to DVD, and basically we'd be asking for immediate funding.
Will you explain the sliding scale or the increasing scale?
Oh, as far as it goes from 10 to So it starts at $10 an hour on January 1, 17. Then it goes up to $10.50 in 2018, also on January 1. Then it goes 11. Then it goes to 12. So we're at $12 by 2020. After that, it's an increase based basically on CPI, on inflation, basically, which is what we have today. If you didn't know it already, today in Arizona, our minimum wage is adjusted on an annual basis by the Industrial Commission of Arizona based on CPI. It just so happens that I don't think there was an increase this last year, but that's where we've gotten to 805 here in Arizona.
The other reason that I asked you about Arizona State and constitutionality is I don't know if everybody is aware of the case that was just decided in Texas. Basically, it was decided that providers do not have the right to sue, that don't have standing to complain about the Medicaid rates unless the entire network collapses.
Right.
And then we're basically all screwed. So if we're going to get any kind of relief, we're not going to get it from CMS and the feds. We're going to get it either from DDD Access or the Arizona State Courts.
The legislature.
Or the legislature.
So January 1, nothing out loud?
Yes.
Yeah, we was our decision to do that, what's the plan?
Sorry, I can't hear.
Oh, what's the plan?
What's the plan if that happens?
If it goes through.
If it goes through. So I don't think anybody.
You came in a little late, so.
So I don't know that anybody actually has a definite plan. From an APAD perspective, what we're looking at is we'd be asking for an emergency appropriation to happen as soon as the legislature goes into session. So if in a perfect world, the legislature, the governor's office, everybody agrees, then we could probably get some additional funding for it at the end of January, because it takes a couple weeks just to get through the process, even if it's an emergency measure. But that's a lot of ifs, ands, or buts, right, that have to happen. But that's what we're working towards.
What did you say the rate would be January 1st, 17th then?
It goes to $10.
Right away,
$10 an
it goes
hour.
to 10.
Right away, January 1.
So
Yeah.
where's the money as far as components of those reports and this, where's the money?
Where would the money come from for it?
Where was money for it? Marketing.
Supporters and opponents of the proposition, where's the money coming from?
Oh, where's the money coming from supporters in opposition? So, and by the way, I should mention, so the opposition campaign is going to have their website up next week, which is why it's not up here. But once we have it, we'll get it. We'll make sure it's updated on the website so you guys can have that. And I will also add the Women's Voter League so that we can have that as well. That's a great idea. So the For campaign is, quite frankly, some folks have told me it's unions. I don't know if that's 100% accurate on their funding. I haven't looked at their financials to see that. But on the For side for the minimum wage, they talk a lot about having a livable wage, about having folks that can take care of their families. And that's what you hear from them. On the opposition side, you're going to see a lot from the chambers of commerce type groups that are going to be on the opposition side, talking about the impact to business, talking about businesses then going to automation, or that they just might have to cut staff, that they can't afford to do this. And so you're going to hear a lot of those types of economic arguments from the opposition side.
It's interesting from the restaurant group, the owners are against it, but the employees are for it. So there's a huge issue there with, well, we're the ones working and, you're making all this money, but the owners of the restaurant association has come out and said, yeah, but do you even understand what this could potentially do and how this would completely, I guess, what's the word? Diminish any kind of profits or anything that we have, or basically eliminate them. So
Do they have a waiter's wage? Like
$2.52.
We do, yeah.
But you gotta have taxes with it, or
Right.
not your taxes, your tips with it.
Right.
And then it has to be up to a certain wage.
It
and you
has to
have-
meet the minimum wage.
Correct, and then you have to, yeah, so it's a whole nother kettle of fish.
I had a question. So I know the polling for 205 is 50-50 right now. But do you know what the polling is for 206?
Two-third for,
Yeah.
third against.
Yep, that's what I've heard. There was some polls that came out, this was last week, that it was about, basically that marijuana would pass. And everybody was like 50-50.
And for 206, we
Or,
actually,
sorry, flip that. Yeah, go
we
ahead.
actually have a couple of national employers who have announced that they'll be raising their minimum wage for their employees. Walmart made the announcements, and was it Starbucks that made the announcement?
I think I've heard that.
Yeah, but you have to
Couple of
remember
times
the
they've
union
talked
piece
about
with
that.
Walmart too, and how they were really trying to unionize them, and that's been a big push, is from the union. I think
Right.
Dave has something.
Yeah.
I think there's a lot of the caregivers has gone down quite a bit. And, I used to do it myself. I do the economy as well myself. And I've been doing my for a long time, because not many providers are making all the hours.
Right,
So I been talking about this, and, it's something that I've been for a while, so the question I have is, what can be done coming together as a group to advocate for a higher wage in order to university, whether it's CMS, whether it's coming from Fed, or whether it's locally, to try to get a wage increase?
It definitely has to happen at the local level.
The grassroots.
And I think there's two things. One, from an APAD perspective, we've been talking about the caregiver issues for a couple of years now. So we talk about the legislature, and what we're trying to do is build that grassroots momentum. So it's not just APAD members talking about it, we're trying to get families, caregivers themselves, individuals, self-advocates to come and talk about these issues. We had one family talking to the appropriations committee. The dad got up there and he brought his daughter with him, and he talked about the fact that she's had a different caregiver about every 6 months, and that is causing a lot of issues in her health care, her behaviors that she's going through, because she needs that steady caregiver. Every time a new caregiver comes in, she's going through issues. And so we've been talking about that. So from our perspective, from an APAD perspective, we need to continue to talk about that. The more we can all talk about it, the better. And then there's the minimum wage on top of that, right? I had a provider, an APAD member at Cottonwood, that was struggling to get caregivers because folks at Safeway were making $10 an hour, and so they couldn't get caregivers. So they, made some changes, cut some things, and had to raise their rates to 10 just so they could compete. And so now they're concerned that if the statewide minimum wage goes to 10, they're going to be in the exact same predicament that they are, or that they were 6 months ago. And even this isn't competitive. They hear from folks, dishwashers that are making $13 an hour. So they're still having these issues. And so, how are we going to work on that?
I have a question regarding the position of the APED members. One of the things that I'm not hearing is that these jobs are not no-skill jobs.
Oh, no, that's a huge focus.
This is skilled employment.
Yep.
And these people shouldn't be making minimum wage.
That's right. That's right.
I'm not seeing a major campaign, though, announcing that.
That's
working on it.
Yeah, that's a huge focus, Dee, and I think the coalition needs to jump on that, because what we have pointed out to the legislature is it used to be direct care professional.
Right.
Professional being the optimum word, and the thing you want to focus on is the professional level of provider that you need in working with our population. And it's gotten to the point where, can you pass a background check, and are you breathing? Woo! You're in.
Right.
And so,
Right,
I
and
mean,
do not have speeding tickets. I mean, that's what it's coming
it's
down
huge.
to.
And what we're trying to make sure that the legislature understands, and the people that we're working with too, guys, because we don't want to be seen, we're already greedy providers, just for the record. We're already greedy providers. So what we don't want to do, though, do we want people to make $10 an hour, 12? Absolutely. Just make sure that you're paying us.
We want them to make more.
We want them to
They
make
should be
15,
making more
20,
than that.
whatever it is. I mean, we all know how hard this work is. It's ridiculously difficult. And so we want this to happen. We just want to make sure that we're not lost in the shuffle where they say, okay, let's add $10 here, $12 here, $15. That's already more than, what you're maybe obviously even getting back for some of your services. So you're going to pay somebody more than you're actually potentially, recovering
Well, one
for
of
that.
the things, I've been part of the system now for 13 years because of my son. And one of the things that I have not seen from provider agencies, I understand this is Arizona, it's the Wild West, caveat emptor, okay? But I don't see the industry being receptive of raising the standards and the requirements coming from the agencies as to who they can actually employ. I remember when Aaron Walker-Rubin first started AZA United, and we had a discussion about what does it take to become a HAB respite worker. And I have no idea who answered the question, but Aaron asked, what does it take to get a fingerprint card? And he actually asked the question, can you get a fingerprint card if you have a felony on your record?
Right.
And the answer was, yes, you can. And, I know this is personal to him. He is a brother. I have a child. I remember sitting next to him, and he was completely appalled.
Right.
So, it's true. We need to
Quality,
emphasize quality.
That's right.
And I think that the agencies need to get the word out that they are willing to have the government raise the minimum standards of worker quality, and that's where more reimbursement is going to come from. I know Gary will tell you in the behavioral health community, he has behavior techs who make a lot more than HAB workers, and that's because the requirement to be a behavior tech, there's a lot more involved than to be a HAB worker.
Well, and there's a lot more involved in being an insurance provider versus the state, the level of provider that's being required, and the level of supervision.
And the level of care.
Correct.
The actual services is a higher quality.
It's a higher
one of
And
the
they
things,
should all do that.
I have the benefit of a whole lot of years behind me now, and I hope I got some wisdom with that. What I've seen happen in the whole healthcare industry, I'm including all of this as healthcare
It is.
wholeness.
Absolutely.
And what we're doing is we need a higher performing, more skilled workforce than ever before to truly bring in full integrated healthcare. The same thing in the behavioral health side, in our introductory level positions. When we get these young women and men who are smarter than they ever have been, they're coming in with such a load of debt for the college. And as a society, when we earlier talked about corporate taxes went down to a third of what they used to be, somewhere we need to basically subsidize a workforce. We can't. What I'm doing right now is I'm hiring young women and men with master's degrees that are coming in loaded with $80,000 of debt. Now, let's take away from me as an employer. As a citizen, I want them to buy a house. I want them to buy into the school district.
Sure.
I want them to have their kids raised in my community.
That's right.
They're too poor to do that. I want them to buy a new car.
Right.
So as a society, we better start understanding all of that.
You want them
The
invested.
second thing is, in my, we're moving further along in integrating everything, but I get these gifted young persons that when the recession hit, they were moving off into selling real estate, they were moving into the finance industry. Why? Because they can relate to people, they know math, and guess what? They get bonuses.
Sure.
They can treble their income. So, so understand, we're not just competing against a $10 minimum wage, we're competing against an improving economy that is going to hire skills.
Sure.
Going to hire skill and talent. Whether or not I used to work with my family member,
Right.
I know how to do the work, they're going to pay me $15.
Right. Well, and as Dee said, the number one concern they have is that we're fighting for the same providers.
Yes.
The ED, elderly and physically disabled, and the DDD type of population, same workers. And it's becoming a cat fight, quite
Now,
frankly.
I don't know how you guys are gonna feel. I only represent families.
Yeah, only,
So,
okay.
well, I'm not a provider.
Kind of
so
important.
I come from a different place, but
Yeah.
one of the things I'm telling my families is they need to start filing quality care complaints when they can't get a provider. So, because I don't think anyone's tracking the data of how many people are authorized to service and not getting the service because there's no one to provide the service.
Right.
And we can all talk about how bad it is right here, but when I was in Yuma the other day, it was frightening. There are people who don't speak English who are getting a speech path who doesn't speak Spanish.
Oh my gosh.
And like, how is that supposed to work? And there's only one, and no one has OT and hasn't had OT in years. No occupational therapist. So, but nothing gets done because our parents don't know how to complain.
Yeah.
So I don't know how you guys feel about that, but that's what I'm advising because we need to track who's not getting the service.
Everybody keeps talking about what we need, the government has to do to get these dollars out there more. I wish somebody would go out and commission a study that would show the effect fiscally on a lack of continuity of care, people changing over, the stress
There you go.
with people. If you're able to show that fiscally over a certain amount of time, it makes more sense. That's an argument you walk into the legislature or wherever else.
Right.
And they're going to say, okay, so yeah, if they're talking about a structured and balanced budget, I love that. It sounds like something that Stephen Colbert would have put out there.
Which is
But-
funny because the state actually did something similar to that within the past year. They actually commissioned a study to see the effectiveness of the services, but their only focus really was group homes.
There you
They
go.
didn't focus on all of the services, which group homes are such a small percentage of our population. We need to be focusing on the in-home services, the in-center services, the therapies, as opposed to just specifically group homes.
Well, I had cancer many years ago, and every year I get this thing from the Mayo Clinic where they want to track whether I'm still alive or not. I never send it back because I want to know. But the point is, some of these studies, they do take longer than just 1 year or 2 year, but they will start showing trends right away. And if somebody would go out and say, we got to figure out, because I think of a person who's not communicative and the stress they must feel when they have a different face showing up every month. That's going to cause more stress, which is going to cause the person to have to stay home more.
Right.
Or end up in the hospital, which
Right.
keeps parents from being able to go to work.
Yep.
So then they stay out, and then they have to take lower wages.
The opportunity costs are tremendous.
Yeah.
We have 2 families right now whose children are going to be there, and they're young, they're under 16, who are going to be placed in group homes because they could not get the services that they needed for the last 10 years. And so now they're going to cost us significantly more money.
That's right.
So I wish we could track how many of these kids ended up in the group homes because they didn't get what they needed to begin with.
So whether it's a group of providers or a group of CEOs that get together, other providers, or it's through APAT or whatnot, formulate some sort of action that says, we're going to study this problem, and then at least you can go to the governor or Bedlack or whoever and say, we're looking at this right now, but it is only common sense.
Sure. And we do have an advocate. I mean, Christina Corriere in the governor's office, sister has autism, and she's an amazing person, and she's been a huge advocate for us. And I really have good conversations with her, but at the end of the day, we all know it's legislature and it's the governor. And Brandy, I want to make sure that we get through all of this.
But this is a really good discussion.
This is a fantastic.
You can if you want to.
This is a fantastic discussion, and I think it's extremely important. And maybe we have another meeting too about what Norm and no. Yeah, okay, you're chief of it now,
I'm
so
just
sorry, now. Good luck with visiting.
Well, if you needed like to collect data from families,
Yes.
we would be.
I know, but that's what I'm saying. Maybe the coalition can kind of take that piece and start running with it a little
Well,
bit.
actually, the coalition will do it in partnership with Greater Phoenix Autism Society.
Well, of course, that's what we want, and then we'd ask APED for their input if they want. We'd have, that's what makes us better.
The only, right, and the only reason I remind you of that
Yeah,
is because for all the individual inquiries,
yes.
because we're not an individual advocacy agency, the
She
coalition,
gets all of them.
we send them
Yes.
to our member agency
Right.
and to Raising Special Kids.
Right, thank God for raising special kids.
So, but the one thing I do want to ask you is, do you have connections with the Morrison Institute? Because this is the kind of study the Morrison Institute would do.
Yeah,
We have talked to them a little bit about it, actually. This has come up. We did internally with the NAPAD, we did kind of to the point that you were raising, you were able to pull, it's not exactly what you're talking about, but the increase in turnover costs to providers, the increase in overtime that's happening, right? That's all cost to the system, to
Right.
your point, that is actually that wouldn't be there.
right.
So we have been having some of those conversations and talking about it, but we have talked to them a little bit about doing something like this. But you're right, it's more of this is a long-term study, right? It's got to take a little bit of time.
Yeah.
I don't see those freedom schools doing this kind of stuff.
Right. Hey, Randy, would you throw out a couple of the numbers? We're not going to tell them obviously who the providers are, but that we received with a minimum wage issue, what their when we went through that with a few of the agencies there. Can you toss out a couple of
What the impact is?
Correct. I think this is a very interesting thing, and I think you guys should hear it, because for all of you that work in an agency and have an agency,
Right.
this is you, because these were APAD agencies that we asked for detail.
Well, I'll start. So, last year there was a 1% increase in the DPD rates that we were able to push forward. And one of the provider agencies was trying to explain to a legislator, 1% is wonderful. We really, really appreciate it. You need to understand what that did, right? So they wanted to give their folks a raise. In order to give their employees a quarter, 25 cents raise, it's going to cost them over $270,000. The 1% only gave them $200,000. So they couldn't even give, a quarter of a cent. For the minimum wage, the data that we've been collecting, it's all over the map because we're very fortunate to have providers that are from all over Arizona, big, small, urban, rural, and so for our smaller guys, you're looking at $30,000 to $100,000 on January 1. For some of the larger guys, you're talking $700,000 to $1.2 million.
Just
On
for the
January
difference between
Wait,
minimum
can
wage
you
and
explain that
that.
again, January 1?
When the minimum wage goes
Minimum
into
wage
effect
increase.
10, that's how
So January
slow.
1st, it goes up to 10.
Yes.
Correct.
Yeah,
And
and so
then
that
they step up their way.
Correct.
And it goes up to, baby steps up. So $10 January 1. And so that, to me, what that tells you is that there are direct support professionals who are definitely being paid way less than $10 an hour right now.
But that would be like, you're doing 500,000 hours a year at minimum wage.
Well, you have to think about the overtime,
Right, drive time?
drive time. You have to think about the fact that they have workers as well in their employment programs.
Right.
It all adds
That's
up.
the difference.
It all adds up.
Overnight shifts, all of that too.
And just to point out that gets people to compliance with minimum wage, but then we are less competitive.
Correct.
So it'll make our staffing issues worse because more people will go work at Starbucks.
Very good point.
And we're going to get attention.
Because everybody's
Right.
minimum wage goes up. Everyone, not just ours, everyone.
So it's a difficult issue, right? Because we want everybody to be making more money.
Should I break up
But
the flag?
these issues,
Does anybody need that right about now?
I worry that this will discourage agencies from opening, because I'm already
Agreed.
looking at the Flagstaff location and halting any type of movement into Flagstaff, because if you move it to 15, I can't afford to provide services
That's
to
like-
members.
I know of, so this is on the DVD side, but I know of providers who have already negotiated their contracts to make sure that if it passes, they can move January 1.
Yep.
And they'll just move outside of Flagstaff.
That's right. And so what's that going to do to those families
Yes.
and those individuals within that area? And one of the schools that has BCBA's going through and becoming, providers and needing to work in some of these homes and needing to work in some of these clinics to get some of those hours that are required
Yeah,
to continue their education.
We're looking at moving autism schools up there, and even that might even be halted because we wouldn't be able to afford to pay our paras for
Absolutely.
that. So,
If agencies move, I would assume that if Flagstaff passes a minimum wage law and the work is taking place in Flagstaff, you have to pay minimum wage. It doesn't matter where your corporate headquarters
The one
are.
provider I was talking about is group homes.
Right.
They would move their group homes out.
Okay.
So then you don't have to worry.
You know what we're seeing?
Because they're not located there anymore.
Yeah. And then the services are no longer in Flagstaff.
Correct.
but with our
Healthcare
contract,
is merger mania. I mean, the unfortunate thing is you're gonna see these big monster organizations because the smaller mom and pop.
That's right.
Where you get the boutique
That's right.
expertise,
That's right.
we have to find a way to preserve that.
There's
but-
going to be a huge division
But you
here,
need a
you're
critical
right.
mass to survive in this
Well,
future
definitely, I
market.
would say it's going to impact you. It's going to impact your families, your caregivers. You definitely need to be telling your legislators, because the only way we're going to, if it passes, and the only way to get increased dollars is through the legislature. So the more we talk to them, the more they're going to hear.
We'll get, from Brandy, we'll get some good talking points for this, guys, because we want to go to the legislature saying the same things. We want to have multiple groups that are working together saying the same thing. So as we work through this more with the legislature and more with some of these talking points, we want to be unified in what we're saying.
So is the strategy going to be to convince legislators to raise the rates or to try to go against the proposition? Because it sounds like if you're going to be fighting 66% of the voting population, that's not a popular stand in an effective way to spend energy.
Right. From an APAD perspective, so you will see in the publicity pamphlet that's published when you get your ballots, you will see an APAD opposition to the minimum wage. And basically what that language says is, we really want to pay our folks more. They deserve more than this. They deserve more than the minimum wage. But unless the state acts, there's no way we can afford to do this. That's basically what the language says when you see it.
Right.
But I will tell you that APAD isn't like out there, because there's a conflict there for a lot of our folks, right? So from our perspective, we're gearing up towards making the fight for the additional funding should it pass.
Are there going to be other, obviously DDD providers are affected, but are there other groups like that?
Oh, yeah.
who
So if you think about,
Those contracts and they're
Yeah.
paying minimum wage?
you think, well, even just simply on the Altex, so you've got the elderly and physically disabled side, right? They're basically in the same boat. And I have talked to some providers on the EPD side that have told us the exact same thing, that if this passes January 1, I'm closing that program down. I cannot afford to pay those caregivers that wage if that money doesn't come through. So you're right, there's other entities. What's that?
What about outside of healthcare?
It isn't something that I've taken a look at, but I'm sure that it's out there. But healthcare seems to be the
Construction
biggest.
workers or,
Yeah. So I don't know.
We forgot we forgot the proposition that caps compensation for hospital administrators.
Did not get on the ballot.
It didn't get on the ballot? Okay. I just want everybody to
But
know
thank you.
that the coalition took a stance against capping compensation for hospital administrators in nonprofit hospitals because we don't want dominoes falling.
Right.
We don't want them to be able to tell our nonprofit providers, our other providers, that they have to cap their administrator salary rates. And we do have coalition members who are nonprofit hospitals.
Right.
The Dignity Chain is a big supporter of the coalition.
Yeah, big supporter.
And has been from the very beginning. So.
Thanks for bringing that up. Just so everybody, in case you weren't aware of it, SEIU, labor union out of California, had come into Arizona and had been collecting signatures to cap administrative pay for hospitals and executives. And they had gotten their signatures. We were headed into the legal process, and the signatures were challenged. And at the end of the day, they backed out, so we never went through the entire legal process. But they talked about the fact that they didn't think they probably had enough signatures either. They also talked about the fact that they wanted to use their money for other campaigns here in Arizona, specifically trying to support Hillary Clinton in Arizona. So they backed out. The assumption is that they will be back probably next time around.
And I know I can speak for the other board members, because there are 3 of us in the room, and we'll be against it again.
Yeah, what she said.
She is our legal counsel.
I'm just saying.
So I will get the slides updated and get that information out. Make sure all that information is available for you all to see. And as soon as some of those other websites are available, make sure you guys can have them. You guys can go look through all the information for all of the initiatives that are out there for both of those and anything else I find. We'll get it all up there for you guys so you guys can take a look at them and make your decisions.
You know, I'm looking at this next slide, but what I hope this coalition will do is approach it as not begging for us getting more money, increase the availability of skilled workforce.
Of course.
Workforce.
Of course.
If
Yeah.
that takes public funding to do so,
Right.
we're all